Welcome back to Healthcare Insight on America's Web Radio. Now, we've just been through the 10 basic principles of a healthcare reform system that is possible, that we can establish, that legislators can pass laws and regulations around, that federal government and state officials can actually implement. Even with ObamaCare in place, state officials and government can allow for some flexibility from Obamacare and implement the ideas that we're talking about. Well, I want to talk about a transformational change from a government-controlled, government-regulated health insurance that we have to now that's dysfunctional. We don't want to move into more government that's even more dysfunctional, but we want transformation. And if followed, those principles we lay out, the 10 principles that we established, will lead to an effective and smooth transition from a dying Obamacare system while maintaining most of the positive aspects of the Affordable Care Act. Got to remember, the Affordable Care Act wasn't all bad. I know Republicans and conservatives, tea marketers, etc., formed in opposition to the Affordable Care Act or Obamacare. But the reality is there are certain parts of it that were very logical, very appropriate, well received by the public, and are parts that we need to retain and build into a new system. So the whole idea of repeal isn't necessarily repeal all aspects of Obamacare. It's talking about repealing the law and then taking the good aspects of Obamacare, the good aspects of that law, and building it into a whole new law that really will provide the kind of coverages and care that people want and people need. So the second outcome that we can expect is consumer engagement. Consumers will become more involved in their health and healthcare decision making if we structure this thing in the right way. Engagement will come from financial ownership, whether that's health savings accounts, whether it's recognition that we can control how much out-of-pocket expense we're going to generate if we do some healthy activities, we maintain our health, we follow the doctor's orders. But consumer engagement goes beyond the financial. It includes health literacy, that is understanding what your health and healthcare needs are, what the treatment plan is, how to help support what your doctor is trying to do. It involves decision support tools, understanding what the options are within your insurance plan. What are the choices that you can make after you buy insurance that will help lower your costs? What kind of rewards and incentives can you get if you're doing the right things? You're maintaining your health. You're keeping your healthcare costs lower. Can you share in the savings that otherwise would go to whoever the risk-bearing entity is, typically the insurance company or your employer or the government? But you need to be engaged in all those choices. The third outcome that we can expect is real behavioral change, not just cost shifting from one part of the healthcare system to the other, not from one person to the other, but how do we really change behaviors? Consumer empowerment and engagement will lead to that kind of behavioral change. Behavioral change includes wellness, prevention, early intervention, compliance with proven care and treatments. It's about plans encouraging personal involvement, well-being, and altering health and healthcare purchasing behaviors. The real issue here is as we move forward as a society, as we move forward as individuals, as we move forward as employers offering benefits to our staff, how do we encourage behavioral change so that we're just not ignoring our healthcare status and hoping that some pill will solve whatever we need down the road, or that surgery is going to replace that joint that's going bad on us because we've been doing risky behaviors and we've been doing things that our body did not really expect us to do. So how do we change real behaviors so that people can listen to their bodies, understand what their healthcare needs are, and take care of themselves for a longer, more productive life? The fourth outcome from all this really is affordability. You know, Obamacare was passed and it's called the Affordable Care Act. The Patient Protection and Affordable Care Act is the full name, but the emphasis has always been on affordability. It's a great term. Unfortunately, Obamacare was not affordable. Affordability is not just about the premium dollars one pays and the out-of-pocket costs, which is what Obamacare was all about. Affordability is also achieved with financial rewards and incentives earned through healthy choices and behavioral changes. Now, the rewards and incentives concepts are talked about a lot, especially with large employers. And we've said already that we'd like to bring some of these same concepts that work for large employers down and available to small employers, to the under 50 life group and the individuals. So affordability is not just the premium that you wind up paying after you've discussed which coverage you want at your kitchen table, but it's after you've made that selection between this year's enrollment and next year's enrollment, the things that you can do, the activities you can get involved in, the services you can access that'll actually give you rewards and incentives that might fill in your entire deductible and co-insurance with the financial rewards and incentives that are provided under that plan. The fifth of 9 outcomes that we can expect is maximizing the financial options. In any program, we need to have lots of choices, as we mentioned before, as part of our basic principles. Well, financing options for health claims should consist of 3 parts: personal budgeting for premiums or minor costs. We can set aside dollars. They don't necessarily have to be pre-tax dollars, tax advantage dollars, because they're relatively minor. It's like buying any other good or service for your home, your clothing, furniture, dishes, food. You can afford small costs that can be set aside. So that's your personal budgeting. How much out of your income are you going to set aside for budgeting for healthcare costs? The second of these 3 parts is third-party reimbursements or insurance. And that's the thing we're really talking about at its core of these presentations is health insurance. How do we create a third-party reimbursement system that minimizes third-party but maximizes the potential coverage that you're going to need? And there needs to be lots of choices for third-party reimbursements. Insurance programs, self-insured, fully insured. There have to be options of health maintenance organizations, PPOs, EPOs, traditional insurance, all sorts of options for third-party reimbursements so that people can choose the one they think best suits their needs, not a one-size-fits-all as required under Obamacare. The third item is savings. Personal savings or tax advantage savings is a real key here. Health savings accounts, health reimbursement arrangements, or flexible spending accounts. These are the different types of savings that you can have. They're not just from your personal budgeting that come out of your paycheck each week, but things that you can actually set aside and take advantage of, and especially if you take advantage of them with tax advantage options that are available. The 6th outcome that we can expect is insurance for the sickest. Now, the last segment, I kind of alluded to this, but the real key of any healthcare system is that no one can be left behind. Health insurance is about financing and financial security when sickness or accidents strike. Any new healthcare system should help the sickest patients with impaired conditions get the best care, the best treatment, and the best understanding of their condition through financial and information empowerment. We don't want to let anybody left behind. In fact, we need to develop a system that focuses on real sickness care, even though we call our system health care. The real issue is that most of it is about sickness, and that's where we need to provide our focus. Helping people who are sick, who have illnesses, whether that's congenital, whether that's something that happens to them when they're young with an accident, whether it's when they're old and they develop the natural maladies of life. We need to take care of those sicknesses and help those people in every way we can, give them the best care and treatment that's possible. The 7th outcome is we can eliminate the diversity of outcomes, whether it's social, racial, geographic, or other categories, the diversity of outcomes can only be addressed once the segmentation of the existing healthcare system is eliminated and Americans are covered in the same system, treated by the same provider groups, empowered with the same information and decision support tools. The diversity of outcomes in our society, along racial lines in particular, is unacceptable. We can do better. We can develop a private healthcare system that gives care and treatment to people who need it, with their own special needs, with their own requirements. And sometimes healthcare in different communities mean different things to different people. Healthcare in one community might mean safety issues, better police protection, more lighting, better grocery stores, more food choice options. So we need to think about that as we're developing this new system. The eighth area of outcome is a culture of health. A culture of health focuses on wellness and prevention rather than on disease and treatments. Health insurance products should measure and reward participation in wellness assessments, compliance with a condition management program, whether that's taking medications, diet, exercise, office visits, maintenance of good health characteristics, and monitoring of key biometrics, blood pressure, cholesterol, nicotine use, body mass index. These are things that a culture of health would focus on and people would begin to recognize and understand. The last and ninth area of outcomes that we can expect, different from our current system, with a focus on the future, is what I'll call holistic care. Holistic with a W in front of it. Holistic, like whole. There are four aspects of human existence: mental, physical, social, and spiritual. Health should be viewed as a dynamic state of well-being within an individual that includes these four areas: mental, physical, social, and spiritual, that are in the right balance. A focus on health recognizes the potential to improve the status of an individual need, regardless of their diagnosis or condition. But the reality is that we need to focus on the entire individual. We need to be able to bring somebody to the help that they need when they need it in a holistic way. There are lots of different ways to help people with their health care. And the outcome really is a much more emphasis on the issues that we mentioned here: behavioral change, the transparency so we can actually understand and get involved in our health and health care, the culture of health, the holistic care, helping each other. There are so many different areas that we should and could do. And that's what we're going to build an outcome based upon the basic principles that we've talked about. So let's take a break and let's move forward to the next section of actually outlining the details, the beginning, the structure of this new system that we've been talking about. So we'll be back in just a second. Please join us when we come back.